now, not to be outdone, I'm going to tell you how we're going to revolutionize the premium channel as well, because that's an important piece also. We know that there is a large number of the population out there, huge number of patients with significant astigmatism who don't have it corrected, right? So currently, last year, toric IOLs, about 4% of all lenses implanted. But really, if you look at the indications for toric IOLs, it could be 50%. That's a huge gap. Why are these people not having correction of their astigmatism? You know, maybe some just say, that's not worth it to me, I can't afford it. But maybe others are thinking, you know, really, what can you promise? What can you deliver in terms of that correction? So we're here to improve what you can deliver with Cassini, and really an integrated clinic and OR. And this is the point. We're not another diagnostic tool. We are a diagnostic tool that can be integrated with a femtosecond laser, with a toric IOL placement, with a microscope that gives you image-guided placement of your toric IOLs, and with post-operative outcome management so that surgeons can continually improve what they're doing. And we've really sort of taken a clue here from all of the history at WaveTech, now at Alcon, and with what they were able to do in terms of integrating what happens in the clinic, in the OR, and then post-operatively. The problem is people get into the OR, they see what Aura is telling them, and they say, wait a minute, what I thought is not what's happening, and now I've got to make a decision while I'm sitting here, the patient's awake, I've got 5 minutes to finish this case, which lens do I put in? You know, they've got a dilemma. So if we could give them greater reassurance preoperatively about which is the right lens, and that reassurance matched up better with what they discovered in the operating room, and they had image-guided technology so that they could then place that lens in exactly the right location and fully correct the astigmatism, we think we'd have an advantage. And we've been doing this already outside the United States. Here's a testimonial from one of the Cassini customers talking about how it's really improved adoption of toric IOLs in Europe. And here's one of our surgeons in the United States talking about how this has really increased adoption of premium IOLs and refractive cataract surgery in her practice, and really changed her practice from what it was before into what it is now, really a flowering of the refractive cataract procedure. We've been working with partners such as Lensar, Leica, and TrueVision, and Ophthalmology to bring together these partnerships that can create an integrated ecosystem in which all the parts are working smoothly. The information flows seamlessly from the clinic into the OR and then back into the post-operative environment. It makes things so much easier for surgeons and the outcomes so much better for patients. What makes Cassini superior? It's really two things: GPS-like coordinates on the surface of the cornea so that we can absolutely determine the axis, and measurement of the posterior corneal astigmatism. And this has become a key point because it explains why we've had undercorrections and overcorrections, those disappointed patients where we can't understand or didn't used to understand what was going on. Now we know we've got to measure the posterior cornea. So let's see what can happen when we measure the posterior cornea. Now, in this case series from Elizabeth Yu at Virginia Eye, you can see preoperatively a wide scatter of corneal astigmatism, including anterior and posterior now in these measurements. And post-operatively, look at this, 94% within a half diopter of manifest refractive cylinder. So those are the outcomes we're seeing. We've replicated this study with 50 eyes at her site. We've replicated this study with even more eyes using arcuate incisions with a femtosecond laser. We've replicated this study at other sites with more than 100 eyes. So we really believe the new standard in correction of astigmatism, corneal astigmatism, is measuring the posterior cornea, using Cassini, using image-guided software to place that toric IOL exactly where it ought to be, and getting 94% within 0.5 diopter of post-operative astigmatism. We've looked at what can be done using the nomograms, such as the Barrett formula, the Baylor nomogram. They don't do as well. And the published data on Aura is not nearly as good, although we know that unpublished data comes a little closer, 89% in one study, but still not 94% that we're now showing. What does this really mean? Well, every time you miss the target, You have to do an enhancement to make that patient happy. And if you used Aura, as Hatch et al. Did, you might spend about $90,000 a year doing that, but you could reduce that to only $24,000 by getting more accurate correction of astigmatism. Thank you very much.